Imagine having every tool you need to succeed on the clinical floor in one place. I remember my time as a nursing student on the clinical floor, digging through charts, looking up lab values, trying to determine what was exactly going on with my patient, and wishing I had a concise way to find all that information. My name is John Haas, RN, CCRN, founder of NRSNG.com and creator of the Nursing Student Toolbox. Let me tell you about the Nursing Student Toolbox really quick. The Nursing Student Toolbox is designed to take the stress out of clinical practice as a nurse. Two of the things you're going to get are lab value cards and medication cards that go directly on your name badge, okay? So these will go on your name badge and you can quickly look at lab values and find what's going on with your patient. This lab value card has 40 different lab values designed in alphabetical order, including ABG values. So you can look at your patient's labs, look at what the normal ranges are, and you can quickly correlate that. These are credit card thickness, okay? These are thicker than anything out there and will last you your entire career as a nurse. The second one has therapeutic drug levels, dosage calculations, insulin peak times, so that you can just really fast find that information, be able to do what you need to do to take care of your patient, okay? That's the goal. You're also going to get 4 different cardstock cheat sheets, okay? These are high gloss cardstock cheat sheets that are going to last you a really long time, okay? These are all designed specifically to give you a very specific set of information. The first one here is probably my favorite. It includes lab values and how to write those lab values out, ABG values, EKG interpretation, dosage calculations. On the back it has the burn rule of 9s, cranial nerves, pressure ulcer, medication antidotes, hierarchy of O2 delivery, Glasgow coma scale, and so much kind of on this one here. This is the one that if I had to bring just one of these with me to clinical, this is the one I would throw in my clipboard. Another one we get here is kind of a cardiac one. It includes basic hemodynamic value graph. Okay, this is going to show you how all the cardiac output, heart rate, blood pressure, how all those kind of play in together to work for the patient. So you can kind of look at this, see what's going on with your patient, and see what types of treatments might be available. It talks about heart failure, Wigger's diagram, cardiac lab values, and what you're going to see if your patient's hyperkalemic, what's going to be going on there, and what are you going to see in their EKG. Then we have the 10 most common EKG rhythms on back there, so you can look at their EKG tracing and be able to say, okay, this is what's really going on with my patient. Then this one has nursing mnemonics. We include some of the most popular mnemonics divided up by OB, PEDS, mental health, med-surg, so that you can really kind of just help those concepts that you're learning click in your mind. Then this one is our pharmacology cheat sheet. This one is really probably a favorite of many students. We have the 50 most common prefixes and suffixes that you're going to see, injection sites, insulin peak times, therapeutic drug levels again, essential meds by class. So we divided up some of the most common medications by different class. For example, psychotropics, analgesics, anti-Parkinsonian. And then this is my favorite part here. This is disease-specific medications. So we've taken the most common reasons people are admitted to the hospital, and then we've broken down what are the medications that patient's going to get. So while you're working on the clinical floor, you're going to see these diagnoses. So what are you going to do for that patient? For example, for sepsis, pneumonia, acute renal failure, we're going to, some of the options would be loop diuretics, ACE inhibitors, H2 receptor antagonists, calcium gluconate. So these are kind of the medications that are going to be given for the most common diagnoses. Another thing that you're going to get that I really like is you're going to get 3 of my cheat sheets, or 3 of my templates that I used in nursing school and on the clinical floor as a nurse to succeed. Okay, the first one is the ultimate clinical brain sheet. Now, people look for brain sheets all the time. This brain sheet, I believe, is the most helpful. After searching months and months and months trying to find a brain sheet that worked for me, I created my own. So this really breaks down everything you need to know by and do to take care of your patient, including tasks, notes, reasons for hospitalization, things you want to look up, lab values, patient vital signs broken down to every couple hours where you can keep track, intake and output, IV site assessment. So more than just giving you something to record what you're doing, this is helping to remind you what you need to do and what you need to work on to get better and become a better nurse. Then this is my handoff report sheet that I kind of require everybody that I train as a nurse, I require them to fill this out and to use this. You get 5 copies of each of these, of the ultimate brain sheet, the pharm drug cards, and the handoff report. Because what this does is it breaks it down by body system. So you have neurological, respiratory, cardiac, gastrointestinal, genitourinary, skin, pain, and plan for the patient. And then beyond that, it breaks it down even more. So for example, under respiratory, what's their O2 delivery? What's their normal SATs? What's their lung sounds? And so that's really going to kind of help you be able to give an appropriate report and make sure you're not leaving out essential information for your patient. It also includes allergies, code status, background, past medical history, past surgical history, and the physicians. Then, lastly, you're going to get these drug card templates. I created, again, these drug card templates because I feel like a lot of what's out there misses some of the key information. For example, what I have added to these is a pre-administration assessment and post-administration assessment, as well as nursing considerations. And so as you're digging through your drug guides and things, I want you to fill these out. This is a great way to remember drugs. Each card has 4 spaces. There's 5 of these. You can make copies and continue to add on. Last thing you're going to get here is an RN sticker. This can go on your car, on your notebooks, on your clipboard, wherever you want to just kind of show your pride. This is just a way to show your pride for being a nurse and for doing something that's so hard. And then you're going to get a couple of little things, a little note from me with some coupons and different codes to access a few of our courses and things online. But that's really what the toolbox is. The toolbox is really the combination of the information you need to succeed in clinicals, to do your paperwork faster, and to really just start taking care of the patient. I want you to learn, but part of that doesn't have to be wasting time looking for information, okay? So I've given you all the information you need here to have that success.